You're listening to the Fix My Feet podcast. Solutions for every step in your journey with the nation's leading foot and ankle specialists.
Hey everybody, welcome back to the Fix My Feet podcast. My name again is Dr. David Waters. I'm board certified foot and ankle surgeon and physician, and we are here today to do our second episode of our podcast, which we decided on Meet the Providers. So today you're meeting myself, lucky everybody. I'm here today with our awesome marketing director, Macy Leonards. She's here to provide some questions and context to everything we're doing today, but we really want everybody to know who's talking on the podcast. You'll also have episodes with our other common guests, Dr. Evan Leonards and Ashley Anderson, our PA, inside of our practice here at Platte River Foot and Ankle Surgeons. So I guess that's enough of that. Welcome, Macy. How you doing?
Hey, Dr. Waters. I'm doing well. Thank you. Thanks for having me back.
I'm glad to have you back. Glad to be here. Yeah. So,
yes. I am excited. And I know the reason that we wanted to do Meet the Providers, like you said, that's the topic we decided on, is we just want you guys to feel comfortable with who is giving information out about common foot and ankle concerns, and make sure that you guys know that these people are the real deal. Me excluded, Dr. Waters, Dr. Leonards, and Ashley, and then the other guests that Dr. Waters has relationships with that will be joining in the future are certainly of the expertise and of the experience that you guys can put your trust in when it comes to your questions. So, Dr. Waters, anything you want to add before we jump into the Q&A?
No, I think that's it. You know, we just want to make sure you understand that we are a trusted source with this information. That's important to us. So hopefully it's important to you.
Yeah, yep, absolutely. So, well, let's jump right into it. Get these people the content that they want and deserve. So, Dr. Waters, you start by telling us a little bit about your education and how you became a foot and ankle surgeon.
Yeah, so a little bit longer process. I definitely came to that understanding later in life. By the time I decided to go to medical school, we had 3 kids already, and I had had a little bit of a previous career, but decided to go back to school and did my undergraduate schooling in Utah, because that's where I was born and raised, at a little state college called Weber State University. From there, did podiatric medical school at Kent State University in just outside of Cleveland, Ohio. So that's 4 years there, just if people are trying to follow the process here. And then went on to do 3 years of surgical training in foot and ankle surgery at St. John Hospital in Detroit, Michigan. And so I spent 3 years there just learning foot and ankle in the hospital, seeing foot and ankle patients, performing foot and ankle surgery. Probably did over 1,000 procedures in my 3 years there. During my 3rd year, I pursued some advanced training that wasn't as widely available, especially in the podiatric foot and ankle surgery community, in total ankle replacements and some advanced hindfoot ankle reconstructive surgery stuff. I did a few mini rotations to get several procedures under my belt. And then after that, I left and joined a private orthopedic group in Farmington, New Mexico. So I was back in 2014. So I've been in practice since 2014. All my practice has always been focused around foot and ankle surgery. I practiced in New Mexico and then Michigan. And then now I'm here in lovely Nebraska, central Nebraska, and eastern Nebraska is where our practice is located. And just really enjoying being in Nebraska and back into more community medicine after I'd been at a large hospital for the last few years prior to this.
Yeah, awesome. Okay, so I'm going to jump back and ask you a question that I actually don't even know the answer to. So you said you were in a different career prior to becoming a foot and ankle surgeon. What were you doing?
Yeah, I was actually a sales manager at I mean, I think people are most familiar with GNC, but we made and distributed products to GNC and other stores like that, not just GNC. So So natural food stores, health stores, supplement products is mostly what we were not involved in the natural food side. We were in the supplement product side. So I managed a sales team of probably between 10 and 25 people. And so a little bit of, that was a long time ago.
That's awesome.
But,
well, that probably helps.
A little bit of that background.
Yeah, and that probably helps with what you're doing today, which we will get into here in just a minute. So let's take this to the next step. So you came to Nebraska, and that's when you started Platte River Foot and Ankle Surgeons, your podiatry practice, a foot and ankle clinic out here in Nebraska, right?
That's correct. Yeah. So I left 3 years in Michigan. Really, my job there was in an academic setting. So I was in charge of teaching and training the senior residents, foot and ankle residents, their advanced foot and ankle surgery techniques and practice and evaluation of patients. So I did that for about 3 years, and I just figured I got a little bug that I could still teach and train, and I could also have my own practice where I could have more control over the marketing and the communication that we send out to the public. There's big misconceptions around what podiatrists actually do and what they can do. And so I knew that if we had our own practice, we could meld those worlds together. And so we have done that. We're going to talk about the fellowship later, so I won't get too much into that right now. But that brought us to Nebraska. We got to start our awesome practice in Hastings and make sure that people have a better understanding that, we're really highly trained foot and ankle surgeons and foot and ankle specialists who really treat, at a high level, all the pathology below the knee.
Yeah. And community medicine specifically is what you're interested in and where you're serving currently. Yeah, I really wanted to get back to community medicine. And for people who might not understand what that means, medicine has many different settings. In an academic setting, you're usually involved in a large hospital that has, a lot of specialties. They're usually a big referral center. They have residents and fellows and all levels of doctors in training involved. And so the attending surgeons, which is what I was, job revolves around teaching and training those doctors and surgeons that are in training still. And you're usually employed by the large health system versus community medicine, where, there's not as big of an emphasis on academics and teaching and training. And there's more emphasis on, doctor-patient relationship and care, delivery of care and quality of care. There's a more intimate relationship between doctors and patients in that setting. The need for providers is greater generally out in the community as well. So, Yeah, and I just want to take a step back. So you just said in community medicine, there's not as much of an emphasis on the education or academia side, but you are an anomaly specifically, and we can probably take it a step into the next topic, a little bit into what's called a fellowship, and I'll let you talk on what that means. But for those of you who might not understand what this looks like, Dr. Waters has truly grown Platte River Foot and Ankles into a huge, like I said, an anomaly of what this practice should look like. So talk a little bit about the fellowship, talk a little bit about weekly meetings with providers and how you're continually putting education top of mind for you and everyone who works for you.
Yeah, so I think the unique thing when I started this practice was it was with the idea of melding the two worlds of community medicine and academic medicine together, because those are both very high passions for me. We started a fellowship, and most patients won't know what that is, so I'm going to explain it a little bit. But when doctors train, they go to medical school. When they graduate, they're doctors. They then go into 3 to 5 years of on-the-job training called residency, where they're treating and seeing patients, but they're supervised by a surgeon who's done with all their training. And in most states, you cannot practice without completing that residency, the on-the-job training part of the training cycle. So once doctors complete their residency, they have the option the very few and very elect of them have the option of pursuing an advanced year to 2 years of training called the fellowship, where the training gets really focused down into some certain very unique skill sets. And so that's what we have here. We created the Nebraska Foot and Ankle Reconstructive Surgery Fellowship inside of my practice. And one doctor a year comes out and trains specifically with me, and there's another handful of doctors on just reconstructive surgery of the foot and ankle. So it's very high level, it's very advanced, it's very focused on academics. Like Macy said, we have a weekly meeting where we just go over cases and over the academics and over what the literature says about foot and ankle surgery, about foot and ankle medicine. And so I really think it's the best of both worlds. We've been able to meld academia and community medicine together with the fellowship and the practice, which I think is a very unique situation and one that I'm really proud of.
Yeah, that's awesome. What can you explain to us a little bit why education is so important to you?
I think there's a few reasons. I grew up dirt poor. I was raised by a single mom. And so I think learned from a young age that probably the way out of that situation would be to educate myself and just be able to work hard and grind. And my mom kind of instilled that in me as well. And so I think that's one reason. And then reason number two is one of the great enjoyments I get in life, and this has not been true just in teaching foot and ankle surgery, but is in seeing students or residents or fellows or players that I've coached, just the improvement that comes into their lives, the skills they develop, watching them go from very little skill set to quite large and advanced skill sets. And that's something that I truly enjoy. And it's not anything that I need. I'm not even compensated for the fellowship, to be honest with you. It's something I do purely out of, I just think that's the right thing to do to make foot and ankle medicine and surgery better throughout the United States. So.
Well, that's awesome. That shows your character too. As a person, I can speak to that Dr. Waters is truly an amazing person. So I want to brag on you a little bit, and I'm going to go through some fun facts about Dr. Waters. And I'll start by saying, if anyone has heard about a total ankle replacement, not many providers across the nation know how to do this procedure. Well, Dr. Waters here was the first at one of the hospitals in Michigan to perform this surgery and is now one of the leading surgeons in the nation. That's one of the points of the fellowship he was just talking about that he teaches. So that's just one incredible thing about Dr. Waters that he probably will be too humble to say without me bringing it up.
I'm passionate about total ankle replacements. I mean, my fellows know that, and we try to communicate that effectively to patients out in the community. But that certainly is a passion of mine, and that is a little known fact about me. But yeah, that did happen inside of our little health system at Henry Ford. Inside of our health group, I was the first podiatric foot and ankle surgeon to perform a total ankle replacement there.
That's pretty awesome.
But yeah, I'm passionate about total ankle replacements and the quality, the way that they can just greatly improve the quality of life for patients. And it's something that's not super widely available. And like you said, there's it's not like every foot and ankle surgeon or every podiatrist is doing those or even close to that. So there is a select group, and grateful that I was lucky enough to get the training, and now I get to pass that training on to the next generation. So
yeah, well, we're certainly all thankful for everything that you do and are planning on doing. I know we've got some big announcements coming up here, so definitely stay tuned to future episodes is what we'll just hint at. So appreciate your time today, Dr. Waters. Is there anything else that you want to tell the people? No,
I hope everybody just keeps listening on. I think we're going to, make this really fun when my two compadres get on here with me and make me laugh and joke a little bit more. But we really want to keep it patient focused. So we hope that the people that listen, whether they're other surgeons or doctors or whether they're patients anywhere in the country, leave your comments, ask your questions in the comments, and that'll help us really drive the content that patients are looking for. Any kind of questions you have regarding the foot and ankle, that's what we really want this to be about, is about what the community is curious about with their foot and ankle, and we want to try and answer those questions and give you really good evidence-based information about those questions. So.
Yep. So check us out online. Our website is prfootlandankle.com. On social media, you can find us on TikTok and on Facebook. We are Platte River Foot and Ankle Surgeons. On Facebook, you can find the podcast-specific Facebook group, the Fix My Feet podcast. And on Instagram, we are at Platte River Foot and Ankle. So go send us a direct message, leave a comment on any of our photos, or send us a note through that podcast Facebook group, and we will be happy to feature it on one of our upcoming episodes. So, Dr. Waters, thank you again for your time. It's a pleasure knowing you, sir. And we will see you on the next episode.
Look forward to more episodes like this in the future. So,
yep, same here. Okay, thanks everyone. We'll catch you next time.
Bye-bye.
Thanks for listening to another episode of the Fix My Feet podcast. To schedule an appointment with one of our providers, visit www.prfootlandankle.com.